Eric, let's start with data slides and some of our key indicators. Noteworthy, 991 cases. We are now at a 21-day average, I think for the first time, long time below 1,000. So we're headed in the right direction. It's slowly going that way. We just hope it continues to go that way. And today we're going to have statistics, data, and some, frankly, makes us very optimistic, and some makes us cautious. And we're just going to kind of lay this out for you today. But again, below 1,000 for 21-day average, just barely, but we're there. And we hope to those numbers continue to go down. Now let's take the next one. Look at the next one, Eric. This is all 88 counties ranked by highest occurrence. Again, there's two really big things to look at as you see how your county is doing. One is the color-coded maps that we have, which takes in 7 separate indicators. The other one is this, which is one indicator. And the one indicator is how many cases that county had, new cases that county had in the last 14 days. Nothing beyond that, but last 14 days, how many cases they had. And then it's modified for population. So you're actually comparing apples to apples. Let's go to the second slide there, which is the top 10. And again, we see a high number of these counties in the western part of our state. We start with Mercer, Putnam, Shelby, Athens, of course, the other part, Pike County, Central Ohio, Southern Ohio, Lawrence County, Southern Ohio, Miami, Dark, Wood, Butler, all in the west, and go on from there. But again, that's one of the indicators to take a look at. Let's go to our coded slides, Eric. All right, Eric, I've jumped ahead. You want to go back? You want to do the antibody? Let's do the antibody ones. Sorry about that. It's my normal pattern. When someone recovers from an illness, they typically develop antibodies which may make them less susceptible to contracting the illness again, at least for a while. And again, this is what the scientists are studying in regard to COVID. You can measure these antibodies in a person's blood. That's why one of the kind of interesting indicators is reported from the American Red Cross. Since June, the American Red Cross has been testing all blood, plasma, and platelet donors for COVID-19 antibodies, and they have been sharing this with us and the public. This chart displays the weekly percentage of donors that had COVID-19 antibodies in their blood and compares Ohio's levels with the U.S. overall. The antibody positivity for Ohio donors has increased from 1.2% in June to 3.3% on September 14th. This is fairly consistent with what we've seen with the national trend, where the U.S. rate is currently at 3.5. Just some interesting data to take a look at. We thought we would share that with you today. Now let's go to the alert system, our color maps. We have some changes. This week we have 9 red counties, an increase of 4 from last week. And as I said, some of this data is good, some of it's not good. The new red counties are Ashland, Delaware, Pike, Scioto, and Stark. Staying red are Butler, Mercer, Montgomery, and Putnam. Putnam dropped off, Portage County dropped off the red list, which is good news. 67 counties remained at the same level. The greatest movement was 9 counties moving from yellow to orange. Although we have seen lower case numbers in recent weeks, as we just talked about a moment ago, the distribution of cases continues just to spread out throughout the state with more and more cases in the rural parts of Ohio. Interestingly, the counties in Ohio that border Indiana, Kentucky, and West Virginia, most of them are red or orange. The number of high incident counties dropped from 21 last week to 20 this week, not much of a change. The population of Ohioans living in yellow counties has decreased during the past 4 weeks, indicating that we have significant spread of the virus again, just more across the state. Let's look at some of the red counties. Mercer County is back on top of our county list for cases per capita this week with 257 cases per 100,000 residents. Although there are small long-term care facility outbreaks in Mercer County, the predominant issues are community spread and spread within families, the local health department tells us. We're also seeing some large events in the county, which certainly can contribute to the spread. Let's go to Putnam County. They continue to meet the CDC's threshold for high incidence. The county has added 81 cases of COVID during the past 2 weeks. They have a total of 568 cases since it started, just to put that in perspective. But we're really focused on, of course, is the last 2 weeks. Local health department officials said they continue to see multiple people in the same family spreading the virus to each other. Schools are doing well. Most schools have modified their homecoming plans to only have a court and are not having parades or dances to help. And of course, all that is to help control the spread. Let's go to Pike County. They are red for the first time, and they are high in the number of incidents per 100,000. Pike County's cases more than doubled during the past week, increasing from an average of 1 case per day on September 6th to an average of 5 per day on September 16th. During the past 2 weeks, the county had 49 cases. They've had 170 total cases since March, just to put that 49 in perspective. The county has 23 cases linked to a large event in a nearby county. That large event resulted in dozens of contacts who have had to quarantine. The county also has a small workplace outbreak and some cases in the local schools. Again, Pike County and all the counties, the schools are just, I think, doing a phenomenal job. Montgomery County, continue at red because they meet the CDC's threshold for high incidence. The county no longer meets the COVID hospitalization indicator, which is great. University of Dayton is resuming all in-person classes today. To keep the virus from spreading and to know what's going on, the university is doing random testing. The county does have some small workplace, daycare, and long-term care facility outbreaks. Let's go south then to Butler County. Butler County continues as red this week because they meet the CDC threshold for high incidence. The county also has a sustained increase in outpatient visits for COVID-like illness. Remember, that's an early indicator, increasing from an average of 53 visits per day on September 10th to now 70 per day. We have, of course, Miami students have returned to on-campus going to school. And, of course, Miami is working hard in regard to that, and we'll talk about them in just a moment. Delaware County meets the CDC threshold for high incidence. There's been a sustained increase in outpatient visits, again, an early indicator for COVID-like illness, growing from 32 average visits per day, September 7th, now up to 53 per day. Let's go back down south to Scioto County. They meet 4 indicators and return, unfortunately, to red this week. The county has had 64 new cases during the past 2 weeks. That compares to a total of 480 cases since the beginning of the pandemic, just to put that in perspective. The county also is seeing a sustained increase in outpatient visits for COVID-like illness, again, an early indicator, growing from 7 average daily visits on September 9th to 24 average visits on September 16th. Local health department officials said there have been some outbreaks in long-term care facilities and at social gatherings such as at weddings. Ashland County, they are red for the first time. The county has had a sustained increase in new cases, growing from an average of 1 case per day on September 6th to an average of 3.5 cases per day on September 16th. The county also has had a sustained increase in outpatient visits for COVID-like illness, going from an average of 2 per day on September 7th to 8.5 per day average on September 22nd. Ashland University's dashboard lists 15 recent positive cases, and local health department officials said they've been seeing some small outbreaks associated with a number of social gatherings, some in the workplace and some in long-term care facilities. Stark County. Stark is red for the first time. They added 197 cases during the past 2 weeks. They've had a sustained increase in new cases, going from 16 new case average per day on September 6th to 21 by September 14th. Additionally, the county has had a sustained increase in outpatient visits for COVID-like illness. Again, you're seeing this trend in some of these counties. And again, those are early indicators. The average daily number of visits there has increased from 12 on September 8th and is doubled by September 20th. Stark County health officials report that an elementary school closed for a week because of the number of students who had to be absent and a problem with staffing, not having enough staff.